everyone. As we all know, vaccines are one of the most powerful innovations in the history of medicine. Diseases that were once feared by many are now easily prevented because of this. As the world continues to fight and win the battle against the COVID-19 pandemic, different countries are now racing and making their efforts to develop and mass produce a successful vaccine to counter this deadly coronavirus disease. On that account, me and my groupmates believe that it isn't safe to take the vaccine right away. Thus, we are not willing to get vaccinated. We must first acquire a thorough research and background of the vaccine before injecting it into our bodies. According to the UK research charity, a vaccine can take more than 10 years to fully develop because of its rigorous clinical trials. The fact that vaccines for COVID-19 are being rushed, there could be a high risk of serious and fatal side effects. Take for example the controversial Dengvaxia, a licensed vaccine that was created to help prevent the dengue fever, had surprisingly imposed danger and bad effects. It was banned in the Philippines because it was allegedly associated with the death of the vaccinated children who have not previously been infected with the dengue virus. Furthermore, it typically takes a few weeks after vaccination for a body to produce T lymphocytes as well as B lymphocytes, which are the body's defense against an infection that would remember how to fight a certain disease in the future. Therefore, it is possible that a person infected with the disease just before or after vaccination could develop symptoms and get a disease because vaccine has not had enough time to provide protection. So here we can see that there is no guarantee of efficacy even if we have already developed a vaccine. When it comes to the making of memo for mass vaccination, it should be done and prioritized as early as today, provided that the vaccine to be injected is well approved by the health experts and has granted a license to manufacture and for public use. As dentistry students who are currently taking up politics and governance, we believe that there is no health for all without vaccines for all. Each one of us has the right to health, which means we all have the right to get vaccinated and to prolong our lives. No one should be left behind. But we should not just wait nor depend for the production of vaccines. Instead, we should do our part by just simply following the health protocols imposed by the government. As Dr. Willie Ong said in this video, we may not have a vaccine yet for prevention, but through wearing of face masks, physical distancing, and open-air ventilation, we can reduce the risk of spreading the virus. That's all for today. Thank you for listening.